So the 2 a.m. test, what is this test, and how can it be used by different programs out there to select candidates? In this video today, we're going to talk about that. What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So just this past week, I was actually listening to a webinar. And during this webinar, they were talking about, all the changes that are happening with the COVID, the changes kind of in the educational system, from medical students to residents, even pre-meds. And one of the speakers kind of mentioned this test that he kind of uses to distinguish one kind of applicant from another. And I thought it'd be really interesting to talk about and kind of applicable to what all is going on, especially since lots of testing centers are closing, the clinical skills, the step 2 CS. For those who don't know, that's a kind of a patient or a paid actor encounter where you have to see this paid actor and you have to figure out their diagnosis. They'll kind of portray some symptoms. You look at their chest x-ray, EKG, and their lab work, and then kind of formulate a plan. And this is, one of those tests that, I think is an absolute waste of time. We spend all this money. I forgot how much it actually costs to take this test. I think it's like $1,500, $1,600, maybe even more to take this test. But, recently they suspended this test. They are not offering this test now due to everything that's going on. And similar to the MCAT, where, there's less tests to take, less testing dates, and, the changes with the step 1, where recently they changed it to a pass-fail, or will be a pass-fail here in the next year or two. So lots of different changes in the educational system for medicine, and how will the program directors, how will they distinguish one student from another? Like how do you pick your applicants? How does one stand out, especially when the away rotations are no longer being offered because of the COVID-19? So this 2 a.m. test, this is actually kind of in the business world also. It's called the 2 a.m. test for hiring. And essentially, some people, residency, fellowship program directors, they use this to determine whether they want to, select a candidate. If you can imagine, if you were out with your friends one night and, you dropped your friend off and then you were heading home and then you had a flat tire. It's, 2:30 a.m. in the morning. Who are you going to call? Who is going to be reliable? Who's going to be that loyal friend that's going to pick up, no matter what the time is, and come out to help you? The first thing you want to hear out of their mouth as you're stranded on the side of this dark road is that, hey, where are you at? I'm on my way. That can be extrapolated into medicine, especially as surgeons. There's other specialties that take a lot of call as well, but especially as surgeons. And I kind of saw this, in my residency training, where I would be on call at night, let's say, for 30 plus hours. In the middle of the night, it's 3 o'clock in the morning or 2 o'clock in the morning. And, it's just me and a junior resident. So that junior resident has to, they really got to know their information. You don't want to call your chief resident or call your staff in the middle of the night for things that you should be able to figure out. And that's, one of the hard parts about being a doctor. It's lots of responsibility, lots of pressures on you. It can be very stressful at times, and that's what MD stands for. It stands for make decisions, besides medical doctor. But you want someone in the middle of the night on your team that's going to be reliable and dependable and loyal and someone that you can actually trust. And this is what this gentleman was actually talking about. He stated that, I won't mention his name of his program, but when he is selecting candidates, he looks for things when he's interviewing them in their application that will tell him whether that person will be a good resident at 2 o'clock in the morning. Can he rely on this, future candidate resident? So, that really made me think, and I was like, wow, that makes a lot of sense, because, all the times I've been on call, and I can know what type of night I'm going to have if I know one particular intern or one junior resident's going to be there versus another resident. And as a chief resident, I really appreciated the junior residents who, stood up to the challenge and, handled their business in the middle of the night without calling me. It allowed me to sleep, it allowed me to do other things, look over all the other patients, manage kind of the things I needed to manage as a chief resident. Yeah, so the 2 a.m. test, will you be able to pass this? How can you show this to the residency directors, the fellowship directors, that you can pass this test? Will you be loyal, reliable, dependable, someone that is trustworthy, that they can, trust you in the middle of the night? The last thing that we want to do as chief residents and also as attendings is to have someone that is, in the hospital, and you have to check every single thing that they do just because of some track record or some mistakes that they made. You just don't want that kind of trouble going throughout your training. So in terms of everything that's going on with the COVID and changes, in the medical education, I think it's important to try to put things in your application that kind of paints that picture that you are this kind of reliable, dependable person that they can rely on. A lot of times it's kind of the academics, the metrics, their scores, letters of recommendation, the research. But other times it's those other things that, people look for in these applications to tell whether someone will be a reliable, dependable, future resident, future surgeon. So the 2 a.m. tests, do you think you guys can pass it? Do you have friends that, will fail this test? Let me know what you guys think. Put it in the comments below. And thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.